have the greatest job in the world, and that's working with dogs.
Best in Show winner is the French Bulldog.
Winston won the National Dog Show. It was amazing. It was exciting. And to have a dog to be #1 dog in this country, you have to have great nutrition. And I always fed Pro Plan. Just like us, when we eat well, we feel good. And I just love that food and what it's done all these years to all the dogs I've bred and all the dogs I've shown.
Welcome to Pure Dog Talk. I am your host, Laura Reeves, and it is our favorite day of the month. It is Veterinary Voice. Dr. Marty Greer, our favorite veterinarian, is here to join us. We love all of our veterinary friends, but Marty is gracious with her time. And we're going to talk today about our bitches that have just had puppies and they have a fever. And we're trying to figure out why. Right? Metritis, mastitis, all the itises. Sometimes people get a little confused. So we're going to kind of walk through all the itises. What do you think, Marty?
I think it's great. And there's a lot of reasons that postpartum bitches can run a fever. So I think it's a really good topic because when you go to the vet, or if you're calling for a vet appointment or you're getting to the vet, it can be a little more muddy than you think it should be.
Mm-hmm. Absolutely. So what are some of the differentials? Like how long since she had the puppies? Is she running a fever? All those kind of things. Am I right?
Yeah. So febrile, fever. Please don't say the dog's running a temperature because they all have temperatures. Even if it's room temperature, it's still a temperature. So please refer to the dog as having a fever or being febrile. And before you call your vet with a sick postpartum bitch, take her temperature. Yes. Please take her temperature, because the second thing the receptionist is going to ask you is what's her temperature, and you'll be like, I don't know. I can't find my thermometer. So have a thermometer dedicated to the dog, have a jar of Vaseline, and be sure that you've taken it and written it down, because by the time your postpartum bitch is sick, you are stressed, you are tired, and you can barely remember your own name. So write down the stuff. How are the puppies doing? Are they gaining weight, losing weight? Are they sick? Because there is a big difference. Both metritis and mastitis can cause the puppies to be sick as well, because the bitch is sick. So mastitis is inflammation and infection of the mammary glands, and metritis is inflammation and infection of the uterus, to be differentiated from pyometra. So I was thinking about this while I was driving. Pyometra means pus in the uterus. Metritis means muscle or uterus, the muscle of the uterus, and pyo means pus, but metritis is inflammation of the uterus. So I'm like, well, are all metritis pyometras, and are all pyometras metritis? So this is what you think about when you're driving.
You're getting a philosophical lesson today, you guys. Yeah. Philosophy and veterinary medicine all together. And which came first, the chicken or the egg? I don't know.
Yeah. But when you're driving, you're not allowed to read and do other things. So you either listen to the radio or you think about metritis and pyometra.
And mastitis. Oh.
And mastitis. Yeah. Exactly. So there's a lot of reasons that postpartum bitches can run a fever. The top two differentials are always going to be metritis, infection of the uterus, inflammation of the uterus, and mastitis, infection, inflammation of the mammary glands. Now, just because the mammary glands are firm does not mean the bitch has mastitis. And just because the mammary glands are firm does not mean you automatically slam her on antibiotics. So let's be clear about that. So if you have taken your puppy count x-ray and you've been attentive during the labor, you should have a pretty good idea that you have had all of the puppies. And if you don't know, the first thing your vet is going to do is say, well, we need to make sure that there's not a retained fetus. I've had bitches come in 3 and 4 days after they've delivered the rest of the litter with a retained puppy. The bitches are running fevers. They're really sick. They feel horrible. And so I'm going to start with imaging the uterus, whether it's ultrasound or x-ray. And, it depends on what you're trying to do. Sometimes we'll do both, just to make sure that there's not a puppy left behind. So this is why you want your puppy count x-ray, and this is why you want to refer to the documents on how to get an accurate puppy count x-ray. And we have already got a lot of information on that, but take her in fasting, take her in after she's had a stool, and get 2 lateral views, a right lateral and a left lateral, and go to a vet that does digital x-rays and that can give you an exact count. And please do not put your x-rays on Facebook, because your friends on Facebook are not going to be able to see how many puppies are there for a couple of reasons. One is that the images are never very clear on Facebook, because we take them as a DICOM image and then they get downgraded to a JPEG when you go onto Facebook, and they're not clear. And so do not ask your friends to do this. And if you really must at least put it up so their head is to the left and their tail is to the right, because that's the only way that veterinarians are trained and have in their head to read an x-ray. So way off topic, but well, sort of off topic, but anyway,
Squirrels.
so
Squirrels.
yeah, so get your x-ray taken and know how many puppies you're supposed to have. And if you didn't have that many, don't go to bed and assume that she's done. When you do take her out in the middle of the night in labor, take your flashlight, take your towel, make sure she doesn't drop one in a snowbank or behind a bush or whatever happens. So first of all, if she hasn't had all of her puppies, we're going to be looking at metritis related to a retained and probably dead fetus. If she didn't deliver all the placentas, and some bitches are better at delivering placentas than others, and most bitches that have a retained placenta don't end up with metritis. So I don't lose sleep over a retained placenta or two. I don't get too alarmed about it unless it's a basset, and then they like to get metritis because they're bassets. But there's a couple things you can do to prevent and reduce the risk of mastitis and metritis, and that's bathe the bitch before she goes into labor. If you have to stick your fingers in, wear gloves. Don't just put your bare hand in there. And make sure you get your puppy count x-ray, and make sure that you're using a probiotic, because we really feel pretty strongly that probiotics can reduce the risk of mastitis and metritis. So have her on a good quality probiotic, and it can be Purina Fortiflora. It can be the new probiotic that Royal Canin makes, that's called Boularde. That's a new one that just came to market in January. It can be one of the Revival products. There's some really good probiotics on the market. Don't use a human probiotic, because your dog is not a human. I know you're shocked by that, but your dog is not a human.
Okay, so metritis is going to be, by definition, within 3 to 4 days of actually having given birth.
Yeah, much past that, and we just don't see bitches coming in with that.
So that's
mastitis,
the first differential.
Yeah.
First differential
Yes.
is it's going to be in the first 3 to 4 days. Do you, and I know I have used this, how do you feel about having people have oxytocin or pitocin or whatever we're calling it on hand to get that last afterbirth or get that last puppy or what have you? Talk us through that.
And I think if oxytocin is used correctly and in small amounts, it's fine. Most people tend to overdose with it. We know from Whelpwise that the doses should be really, really small. Oxytocin comes in one size, and that's a size that's meant for pigs, cows, horses, sheep, goats, dogs, cats, everything. So it's usually 20 milliequivalents in a milliliter. So a tenth of a cc is 2 units. So you want to use no more than about a tenth to maybe 2/10 of a cc on even a really large dog. And there's some oxytocin rules. You don't use it before the first puppy is born. You don't use it if the bitch is already in hard labor. It's fine for a clean out shot. And I'm absolutely fine with doing it that way, especially if you already know how many puppies there are. You're not trying to clean out the last puppy. You're trying to clean up the placentas that might be left behind. So don't put your little grubby fingers in there. Wash your hands, put on your gloves, be nice to the bitch, because she doesn't want your little grungy fingers sticking bacteria and all the other stuff that happens in the world up into her vaginal vault, because that's going to get you into trouble. So as tempting as it is to reach in there and try to help the bitch deliver a puppy, wear gloves. Please wear gloves.
Good. Okay, so metritis is going to be very early after the puppies are born. Treatment plan for metritis specifically?
It's usually a combination of antibiotics, and it needs to be one that's appropriate for a lactating bitch. I usually give anti-inflammatories like Metacam or Rimadyl, because they're running a fever, they feel crummy. If you can get their temp down faster, they feel better faster, and they're better able to continue to drink, continue to eat, and continue to lactate, and therefore take care of the puppies. Oftentimes, if I know on ultrasound that I can still see a placenta or placentas left behind, I will give oxytocin if it's in the first 24 to 48 hours. And after that, we typically think that the uterus is no longer estrogen primed and probably will no longer respond to oxytocin. So you may have to go to a prostaglandin, which is only going to be something that your vet will use. And many small animal vets aren't going to have this in their refrigerator or on hand. So you may have to go to somebody that either orders it and gets it the next day, or somebody that has access to some large animal drugs, because mostly those are large animal drugs. So this is where you need to be friendly with, or your vet has to be friendly with some people that are in their community that may say, oh yeah, I got a bottle of that. Here, let me help you out with that. They're not expensive drugs to keep on the shelf. They're very reasonably priced, but if it's not a vet that does a lot of reproductive services, they're going to look at you like, what? Like
My God.
prostaglandins?
Why are you
What?
doing that?
I don't
Yeah.
I don't have that.
Yeah.
So, you want to keep your options open. So don't be mean to anybody.
mean
Be
to
nice to the
anybody.
large animal. No, don't cut off the large animal vet, be nice to them.
Yep. Be
Because
nice to
those are
everybody is
important
the right
things.
answer.
Yes.
Okay.
So typically that's going to happen a few days, 24 hours to 72, maybe 96 hours post whelping. Mastitis can happen anytime before she whelps, all the way through to the time that the puppies are well
Before
weaned.
she whelps. Now that I have
Yeah.
not, I don't remember, even in our
It's
conversations, I don't remember hearing that one.
it's not common, but every now and then we'll have a bitch that comes in that's have a false pregnancy or something else, and
False. I
she
have
just
heard with a false. So, okay. Interesting.
Yep. So again, keep her mammary glands clean. There's a product called Nursemaid Wipes that Revival has, but it's going to be leaving the market shortly. So they're wipes that you can use during the time that the bitch is lactating. They're safe for the puppies you can wipe off the glands, and then the puppies can still nurse on them. And so again, I was talking to a lady earlier today, and she's had a number of bitches with mastitis. And I think it may be in part a hygiene issue. So bathing the bitch in a nice antibacterial shampoo several days before she whelps is a good idea. Keeping the mammary glands clean is really important. Your probiotics are really important. And unlike my dear husband that took my 3-day post C-section bitch out to help load the sheep into the trailer, we do not recommend that you take the
Still
bitch out
can't
into
believe
the
that story.
pasture in the mud and the manure to load the sheep when they're 3 days postpartum, post C-section, not just postpartum, post C-section.
That's
Let me
gross.
just point out.
And
Little
it's a
Champagne
corgi, so
was,
it's already about an inch off the ground. I mean,
yeah.
come on.
And Little Champagne was like all over it, man. She's like, oh, great. A break from the puppies. I'm like, no, Dan, are you serious? So yeah, he got into some serious doo-doo that day.
Yeah, Dr. Dan, you're busted. Okay, so I have always used a diluted chlorhexidine solution for cleaning
Yep.
mammary glands pretty much daily.
Yeah, it's a really good product,
Works.
but it tastes nasty. If you've ever put it in your mouth, it
Yeah.
tastes pretty nasty. So you want to make sure you
Yeah,
rinse it off really
you
carefully.
rinsed. Yeah.
Yeah. And you can use baby wipes, aloe baby wipes, something that's reasonable, baby shampoo, something that's reasonable to use on the mammary glands so that you can keep her clean. Now, you don't want to scrub them to the point that the oils come off, because the oils are part of the way that the puppies find the mammary glands. So when we do C-sections, and we started doing this, 10, 12 years ago, we started scrubbing only the incision site, and then we put an adhesive drape on the mammary glands so that the oils are not scrubbed off surgically. My daughter at the time was doing her master's degree, and she found an article that rat pups, like baby rats, were
right.
better able to find the mammary glands if the mama rats weren't scrubbed clean. And so we respect that. So we want them clean, but not so clean that they lose the oils and they lose the scent that the puppies need to find the mammary glands. So it's not just on feel. They just don't feel the nipple, but they also can scent the smell of the nipple and, feel all this stuff, because they can't see, remember?
Right.
Their little eyes are closed, so they're not
heat-seeking
looking.
missiles. That's all they
Yeah.
are. Heat-seeking missiles. That's interesting. Okay. I like that.
Yeah.
So for people, and I know I've experienced this, for people after a C-section, if your vet isn't following this protocol, if your bitch has been scrubbed down, there's a reason your puppies are having a hard time finding a nipple. And
Yeah.
I've
So-
lived through this. Like I've had to
Yeah.
teach the puppies how to, find a nipple.
Yeah.
Oh.
Yeah. So rinse off all the smelly stuff. And then we also typically will put placental fluid on the puppy so that the bitch is more likely to want to take the puppies, but that doesn't help the puppies find the bitch. It just keeps the bitch from pushing them away because they smell like laundry soap. They smell like Tide instead of Gain or whatever your vet is using for their laundry soap. So those are important things.
I'm Laura Reeves, the host of Pure Dog Talk, and I'm coming today to talk to you about Brilliant Pad. And it is amazing and an incredible way for me to do my potty training with the puppies and not ever have to touch any yucky stuff. Brilliant Pad literally rolls the mess up and you never touch it. So I really wanted to talk to you guys about that, share with you the experience I had with it. It's like the most amazing thing you've ever seen.
Also with mastitis, I have found it's super important to keep toenails trimmed short. Yeah.
Yes. Toenails trimmed short. You can't do anything about the teeth once they start to come in.
Yeah. That's
So, yes. Oh, yeah. But the toenails are easy to clip. And,
Yep.
you should do them every couple of days because
Right.
those are angry little things that are touching mammary glands. So, yeah. And again, for treatment, you're going to talk about antibiotics. Again, they should be something that's safe for the puppies to be exposed to. So that's going to be Clavamox, cephalexin. I try not to use Baytril or Trimethalsulfa, but sometimes you don't have a choice. Again, an anti-inflammatory like Metacam or Rimadyl because they're running a fever and they feel good. Again, IV fluids or sub-Q fluids to keep her temp down and to keep her lactating because she may not be eating and drinking very well for 12 to 24 hours. A lot of vet clinics like to wean puppies as soon as they start the bitch on an antibiotic. And I think that's really pretty detrimental. There are very few antibiotics that are going to pass into the milk in a large enough quantity that they're going to cause an issue. And so there's a book, if you're looking for something that you can use as a resource, there's a book called the Harriet Lane Handbook. It is meant for physicians. It is given to every medical student as they go through their clinical rotations as a free gift. And it's meant to tell us what the mammary gland and what the placenta allow to pass through. So if you get a copy of this, you can buy it on Amazon as a used copy for a couple bucks because when they become the old edition, then they sell them on the eBay, Amazon, whatever reseller that you want to buy from. And it has a little diagram of a mammary gland and a little diagram of a uterus. And so you can read the book and say, okay, in the human, this antibiotic crosses into the placenta, or this antibiotic does not cross the placenta or the mammary gland. And so you've got a pretty good reference. So we get to use the human as the animal model for our dogs. And typically the older editions are up to date enough because our drugs are usually a couple of years behind what the human drugs are that come to market. So it's a really nice book to have as a reference. And if you see one on Amazon or eBay or whatever for a couple bucks, buy two, buy one for yourself, buy one for your vet, take it in, give it to them. And I mean, it's very graphic. It has a little diagram and it's A, B, or C, and it's really easy to follow. And so it's just a really nice reference to go into your vet clinic and say, well, look, I think this antibiotic is safe. Do I really have to wean the puppies? And I virtually never wean puppies for mastitis or metritis. And the other thing to know about mastitis is sometimes if you don't get ahead of it fast enough, the mammary gland will slough, open a big hole. And then
that's why I was going to go into the necrotizing mastitis, which is horrible.
Well, there's a couple, there's gangrenous mastitis and there's necrotizing mastitis. So we have to be clear about that.
Okay.
So if the bitch isn't feeling good, as soon as you can, get her on antibiotics, get her on fluids, get her on anti-inflammatories, keep her mammary glands clean. And then you're going to want to keep a very close eye on the tissues because they can change fairly quickly. And if the hole develops, I still don't wean the puppies. I will take paper tape and close it the best I can. I almost never suture them closed because they really need to heal up themselves unless it's gangrenous mastitis. Gangrenous mastitis is when the gland literally turns, there's a black line where it goes from normal to abnormal. And those are really, really bad. Those bitches will get very, very sick. So as soon as you start to see anything,
do you see my face?
Yeah.
This is a no.
I know, I see it. You don't. I've seen a couple of them. You never want to see one. Trust me. But as soon as she starts to develop mastitis, go to the store and buy the cabbage leaves. Buy a head of cabbage. I mean cabbage, like the stuff you would make coleslaw out of. Cut it in half. Take those leaves and put them on her mammary glands.
Cold, right? From the refrigerator, not just room temperature.
You got it. And you can get many layers because the cabbage comes in a lot of layers. It can't be lettuce. It can't be kale. We can't go off the rails here. Cabbage. Well, I've had people that they always want to substitute something else. When I say canned spinach, I mean canned spinach. I don't mean cooked spinach. I don't mean fresh spinach. I mean canned spinach. So when I say something, I'm pretty specifically clear about what I want.
Yep.
So a head of cabbage, I usually use green, but if red moves you, that's
Purple
fine.
would stain them. Oh my
Purple.
God, the
Yeah,
grossness.
purple will stain. And there's several different kinds of cabbage on, at the grocery store. So buy some cabbage, and it can't be pre-chopped for coleslaw. It has to be the leaves. And I don't know who, 500 years ago decided that a cabbage leaf was a good idea, but it was probably some poor woman standing in her kitchen that had a passel of children and went, boy, my bosom doesn't feel good, and this feels better. So here you go.
I'm holding this cabbage to my bosom. Oh, wait,
That's
it
right.
feels better now.
Well, nothing else, it cools it off, because it's got to be pretty miserable to have
Oh my
mastitis. I
gosh.
managed to
Oh.
escape that, and I would like to never try it.
I don't even
So,
want to know. No, peace out.
well, people get mastitis without
Yeah,
having
no.
babies too.
Oh, yeah.
So it
Oh.
can happen. So just be aware that you don't have to be lactating to actually, lactating and having babies to have that happen. So anyway, so those are the things: cabbage leaves. And then, just be smart about it. If your vet doesn't prescribe an anti-inflammatory, ask for one. Make sure that you're using an appropriate antibiotic, and ask them if you can please not wean the puppies, because generally the puppies are really young and they need their mama.
See, and that's really interesting. The only time I've ever had like major mastitis was closer to that 4 to 5 weeks where they're ready.
And then you can wean. Yeah.
Yeah. I've never
Yeah.
had mastitis in tiny tinies. Most of
Yeah.
mine were
And if
ready
you,
to go anyway.
yeah, if you do, it's pretty rough. The other thing your vet can do, if the puppies are 5 weeks old and ready to wean anyway, is you can start them on cabergoline, which is a human drug. You have to talk to your vet about this, and they can look up the medication, but they can start them on cabergoline, which will help to dry up the milk faster. So if you're at the weaning point, that's a great choice. If
Okay,
they're 3
talk
days
more
old,
about
you don't.
this, because I don't think, I mean, we've talked about lots of things. I don't remember hearing about this drug, and it's got to beat starving them to death, which is usually what I do to drop the milk supply real fast.
Right. So cutting the food and water in half will rapidly create less lactation. But if you're in a situation where you've got a mastitis that's really severe, or that it's just time to wean the puppies, you can get cabergoline. It's a human drug called Dostanex. They'll have it at the human pharmacies, and that will help to dry up the bitch fairly quickly. It comes as a tablet with 8 tablets in a bottle, and usually the pharmacy will make you buy the whole bottle, but it's like $35. We're not talking anything that's really ridiculously expensive. So again, that's something that you can talk to your vet about to help kind of dry things up and get things resolving more quickly.
Good to know. That is a good one to know. Okay. So
And
later
then
into the pregnancy, more likely mastitis. Early in the pregnancy, definitely metritis, possibly mastitis. And you're not going to have Pyometra in a bitch who's just whelped.
right. So by definition, Pyometra is in a post-ovulation bitch that's not pregnant, or is pregnant in one horn and has puppies in the other. So that's before whelping, and that's under the influence of progesterone. So Pyometra is when the progesterone is above 5. Metritis is after the progesterone drops, and after the progesterone drops, then the bitch will end up with some reason a bacterial ascension into the vagina and up into the uterus, or retained placenta, retained puppies, something along those lines that'll cause it. So by definition, Pyometra is with a high progesterone, and metritis is with a low progesterone. And like I said, philosophically, I mean, language-wise, I don't know that it matters that much, but if you're talking to your vet, you want to make sure that you give them the right bit of information.
For sure. And Pyometra, from what I remember you've told me in the past, typically does not have a fever associated with it.
Correct. And that's really hard for me to understand, and really hard for a lot of people to understand, because if you have a uterus full of pus,
Right.
you would think your body would go, oh, because the white count goes up. I mean, I've seen white
Right.
counts over 100,000 with this.
Right.
But it doesn't always go that way. I just had a Pyometra bitch in a week and a half ago that went into the emergency clinic over the weekend. Her white count was frighteningly 6,000, but it went up to 47,000 within 48 hours.
Oh, wow.
And her platelet count was 20,000, dropped to 3,000. So she was not
Oh,
a
shit.
surgical candidate,
No.
because she didn't have the ability to have her blood clot. So we were on the cusp of, like, the client was pretty sure that she was going to lose this bitch. But we were very fortunate that we were able to treat her medically, get her through the immediate period. And she also had anaplasmosis. So we're not sure how much of the fever and how much of the
Oh, Jesus.
low platelet count. I
Poor
know. Well,
dog.
welcome to Wisconsin. This is the way it works in Wisconsin. Anaplasmosis, Lyme disease, and Ehrlichia run rampant. And so that's the next thing I want to say is not all postpartum bitches have mastitis or
Right.
metritis.
Right.
So anything that can make a bitch have a fever any other time can also cause her to have a fever when she's postpartum. So you've got to think about Lyme disease, anaplasmosis, and Ehrlichia. So you need to run the Accuplex 4 or the Snap 40X. You know, you need to start thinking about it's. So is she postpartum and sick from being postpartum, or is she postpartum and just happens to be sick from something else? Did she pick up parvo? Did she pick up, you know, one of a lepto, one of a million other things that it could be? Does she, you know, does she have an abscess someplace that she stepped on something or drove a foxtail into something? You know, anything that can make a bitch sick when she's not postpartum can make a bitch sick when she is.
Quick question, and I honestly just think this is an interesting question. So many things, pregnancy is a stress on the body. It triggers a lot of sort of latent problems. So do you see more manifestation of your tick-borne diseases in a postpartum bitch because it's the stress of labor?
We definitely see it late term pregnancy, and we know pregnancy is immunosuppressive.
Mhm.
So we can definitely see it. We've had bitches get really sick from Lyme disease during late pregnancy and during lactation. So yes, yeah, all those things happen because the system, I mean, the whole system changes when
Right.
they're pregnant.
Right.
They have a hypercoagulable state, so their platelets go up, and you know, there's just a multitude of things that happen physiologically. So that's why I don't want people to just assume that it's mastitis or metritis, because anything can cause anything.
Right.
And, you know, you just have to take a giant step backwards and not have tunnel vision that the only thing she could have is mastitis or metritis. No. She could have hundreds of other things that are wrong with her. So those are all really important things to consider and just to discuss with your veterinarian so that nobody gets tunnel vision and goes down the wrong path when they're making diagnostics. So anti-inflammatories, fluids, supportive care, antibiotics, and then sometimes that's what you do for the first 24 hours until you just
No matter
figure
what.
it out.
Right.
Yeah, because at least you're giving the bitch supportive care and keeping her going and keeping the puppies going. And clearly, if she's not able to adequately lactate, then you need to be pulling those puppies to supplement them, but not necessarily to pull them exclusively off of the bitch.
And I know we covered this because we just did a big mastitis topic, I don't know, 6 months or so ago, and we talked about it then, but I want to remind people, do you encourage to block off if there's one particular gland that's particularly like oozing green goo? Do we block that? We don't let the puppies nurse that?
Yeah, you probably want to milk that out to keep it from becoming too much of a problem, but I would discourage puppies from using it. You can put paper tape over it or paper tape over the gap if there's an opening in the mammary gland that happened because of the slough. And like I said, occasionally I'll close those surgically, but many times we just let them granulate in and just try to keep the puppies out of that area. But these are kind of tricky to try and manage because you've got not just one patient, but you've got the patient and all the babies. So it's a little bit of a struggle to do these things. And especially if you're working with an emergency clinic or a vet that's not oriented toward working with breeders, it can be a little bit of a challenge because everybody wants to wean.
Right.
Now, if they're 2 weeks old or older, then weaning is okay. I grab the Royal Canin starter mousse and start, putting it out, and the puppies will eat that pretty readily. But you really try hard to not have to do that. I've had 12-day-old puppies. I have a litter of 12-day-old collie puppies that I have video of that didn't have their eyes open yet. Put the food out for them on a very, very flat, shallow plate, and they couldn't see where they were going because their little eyes weren't open yet.
Right.
But they could feel, they could smell, and they were just diving into the food because they were hungry. So if you have to bottle, if you have to tube feed, if you have to feed them off of a plate, those are all pieces of things that you have to simply do to keep them going. Because I don't want you to lose puppies just because you went, oh, well, the bitch is sick. That's a pretty lousy excuse.
Yeah, we can bottle feed. We can, like I said, I've had mastitis, just not very often, but I've had it. And it's usually been in that towards the end of things where she's starting to dry up. She hasn't really gotten dried. They're still nursing like once a day. And she's got too damn much milk. And they've got sharp teeth and claws. And, no matter what you do, that's where I run into mastitis.
Right. And I actually had a client that called me many years ago. She called me on a Saturday afternoon. We were closed. I was driving. She called and she said, I think my sister's dog has mastitis. And I'm like, oh, well, what makes you think that? And she said, well, she won't lay down to take care of the puppies. They'll let the puppies nurse anymore. And I said, well, how many puppies does she have? And she said 12. And I said, well, how old are the puppies? And she said 6 weeks. And I said, and what breed is this? And she said, a Labrador. And I said, so what is she feeding the puppies? And she said, feeding them?
Oh my God.
And I said, okay, well, what is she giving him to drink? And she said, drink. And I almost drove into the ditch because I was like, oh my goodness sakes. I said, okay, as soon as we hang up the phone, you are going to call your sister. The first thing she's going to do is put a shallow, flat dish in the pen with the puppies, take out the bitch, and give them water. The second thing she needs to do is screamingly fast drive to the store and buy a bag of puppy food and start feeding the pup. Can you imagine 12 Labrador puppies that are 6 weeks old?
No, I cannot.
Ravaging this bitch.
I can't imagine that there's a bitch still feeding them. Like the wire hairs, 4 weeks, man. Done.
Oh yeah.
Peace out.
Corgis too. The corgis are done by
4
3
weeks. But 4 weeks are like, if I can push her to 5, it is some kind of miracle dog. The Spinoni, the stupid Spinoni. I'm sorry. I didn't mean to say that. Spinoni are very sweet, loving, kind dogs, and they will feed their babies until they're 8 weeks old because they don't have enough lick of sense.
Well, my farm dogs will do the same thing because they love their babies, and Cavaliers love their babies, and Goldens love their babies.
Love their babies, and we'll feed them till 8 weeks old. I'm like, no, please stop.
Yeah,
please stop.
There's a limit, man.
Please stop.
And that's the other thing is, a couple of years ago, my first farm dog bitch, I had her out in the yard with the puppies in the dark, and I could hear this noise, and I thought, what is that? And then I realized she was vomiting for the puppies.
Yes.
And don't forget that bitches will vomit for their puppies when they get ready to wean them. So I've had people call me and say, oh, my bitch is sick. And I'm like, well, what makes you think she's sick? Well, she's vomiting. Well, how old are the puppies? And if they're 5 or 6 weeks old, the bitch is like, done. Stop. I'm just going to eat. And then you eat what I ate. And then we're all good.
We're all good.
So,
and I think, you are a huge fan of Royal Canin, the puppy starter mousse. I'm not as much, but cool. I make my own, right? So I make, and I tell people, when you make your first puppy slop, quit with the rice cereal garbage, and you get your kibble and you soak it and you mush it and you put a little yogurt and a little cottage cheese and a little ground meat and it should be the consistency of puke. And they look at me and I'm like, no, really, because bitches throw up for their dogs, for their puppies, right? Like that. The consistency of the first food that puppies eat should not be milk. It should be puke. And so I think that is, I think they get into trouble because these puppies are like aspirating milk and all this other stuff. No milk. Puke.
Right. And I completely agree with that. The other thing that I have found to be useful is when you're when you're soaking the kibble, whether you soak it in formula or warm water or whatever, I put it in the refrigerator a meal ahead. So I'm not standing in the kitchen waiting for the food to soak the water into it. I've got a batch ahead, and then I pull it out of the fridge, warm it in the microwave enough to take the chill off, put that in with the puppies, and then the next bowl goes into the refrigerator. 100%. So you've always got that ahead. And you can use muffin tins, you can use the flying saucers for weaning, you can do lots of things that are really effective. And for water, I like the chicken waters that are the round ones that have the little, because then the puppies don't go swimming. Yeah, they don't go swimming in it.
They're wire hairs. And my dogs would be swimming in it no matter what.
Well, it's only this wide, so they'd have a harder time swimming. So there's a lot of techniques to doing this, and there's some definite tricks to it. I also like the Lixit water bottles. I'll teach puppies to use those by putting something like chicken baby food on the nipple of that. Those are the ones that look like the giant turbo bottle with the metal tip and the ball in the end. So you can teach puppies to drink out of those, but make sure that they are all drinking out of it, that you don't have one that's kind of slow and it doesn't understand and it gets dehydrated because it wasn't part of the crowd. So there's a lot of great ways to work this, but please, please, please make sure everybody gets access to food, everybody gets access to water. So the flying saucer dishes are nice because they're big, or you might need more than one depending on
I
how big
have
your litter is.
3. 3 huge ones that when I have a litter of 12, I'm using all 3 of them by the time they get to be, 6, 8 weeks old.
Yep.
So,
Yep.
all
I
right.
hear you.
Marty, thank you so very much. If you guys are not
Sure.
watching the YouTube, you definitely should. Marty's been fending off a fly all night. So
It's the first fly I've seen all season, and it's in the lunchroom. Are you kidding me?
right against your bright white jacket and your bright white whiteboard. and I so first I'm like, what is that blur? Oh, okay.
Yeah, I haven't seen a fly outside. I haven't seen
Oh
a
my
fly
God.
anywhere, but no, it's
Okay.
in the lunchroom.
Here it is.
Great.
It's spring. Excellent. All right, Marty, thanks so much. Don't forget, everybody, if you have not twigged to it, the Marty and Laura show, right? For your puppy buyers, your brothers, cousins, uncles, girlfriend. All right?
Saves you a lot of time.
It's a good time. All right. Thanks, Marty.
Of course.
Peace
Thank
out.
you.
Good night.